Hi everyone, it's Nishti here, and I want to talk to you about the issues around skin prick testing in children with cow's milk protein allergy. And this specific form I'm talking about is the non-IgE, so the non-immediate type of cow's milk protein allergy here. So I meet a lot of parents who want a skin prick test despite the fact that their child is showing clear symptoms of an allergy to cow's milk. So it could be reflux, vomiting, eczema, diarrhea, constipation, excessive wind, arching their back, colic. So these are just a few symptoms of a non-IgE mediated cow's milk protein allergy. And families always want a test. And I understand why, but in this video I'm gonna explain what the pitfalls are of a skin prick test, and I'll explain through a client story because I feel that may help you to put it into context, and then obviously it's up to you what you want to do with that information. Because a skin prick test, the issue with that is, yes, they are very quick to do and cheap, and they do come up with some results, and we like to see that. We like to see numbers, but the problem is a skin prick test can show you that your child has an allergy to something, such as milk, but actually they are not allergic to it. Or it could show you that they are allergic to it, but they are not actually allergic to it. So it can give you false results. So if you have a test that then also shows that your child is allergic to wheat, then some families actually eliminate the wheat, because the wheel, so skin prick testing, it comes up with a wheel, and if it's large, it shows you're allergic to that particular food. Then families tend to eliminate that food. And this is a huge issue. We rely so much on these tests when actually they are not reliable. They are just there as a piece of a larger puzzle, if you like. The best indicator is a clinical history. So as a registered dietitian, what I would look at, and what your doctor also should look at, is, okay, what are the clinical symptoms? So your child may have eczema, okay, diarrhea, great, we know that, that's a clinical symptom. So we then suspect cow's milk protein allergy. And what we do then is we will eliminate the protein, so the cow's milk protein. So if you're breastfeeding, we'll tell you to go dairy-free. And if you're formula feeding your child, you will be provided with a milk-free formula from either your doctor or your dietitian. And we'll give it a few weeks and see how you get on. And then we will reintroduce so if you're breastfeeding, we will tell you to have some dairy, or if you're formula feeding, we will tell you to include some cow's milk formula, ordinary cow's milk formula. And if your child reacts, then we know this is actually an allergy to cow's milk. So that's the best type of diagnosis, because we are using the body itself as a tool, and we are not using a test that, I mean, we're so focused always on something on the outside to help us, but we never actually look at our own body and the symptoms that they clearly show. And I feel this is a huge problem. I know that for a lot of parents, a skin prick test brings them peace of mind. You know, I always say that it's a false peace of mind. What we should be focusing on is the baby in front of us and their symptoms. If it's non-IgE cow's milk protein allergy, and for us professionals, it's very, very clear to us. In most circumstances, we know if it's non-IgE or IgE, and even you would know, because an IgE is immediate and there's no discussion. You have to be very, very careful. There is nothing about reintroducing any milk anytime soon. But for the non-IgE, it's all about clinical history, family history, and with a professional, it's about eliminating the milk and then put it back in safe amounts and making sure that we don't cause any issues, and also that we provide you with the correct diagnosis. And I also think, you know, with the skin prick test, it's putting our babies through more stress when really it is clear your child has cowsmilkproteinallergy, it's non-IgE. You need to work with the professionals and it will all be okay. Now, you can go private and get a skin prick test done, especially because perhaps in the NHS they would have told you they don't want to give it to you. And I actually think that skin prick tests can be a waste of money. I feel that it's not really needed in a non-IgE population. You know, if you go private and you pay for it, that's of course fine. But I do believe that, I don't know if I should say this, but I'm still going to say it, because I really mean this with a lot of love. What's the point? If the test will show you what you already know, why do you do it? Why pay for that when really the best indicator of an allergy is the body's own reaction? So eliminating a food, observe, keep a food diary, and put it back into the diet. Observe, keep a food diary. Work with the professionals. Now let me give you an example of a client of mine, and this, I will never forget this example. There are plenty more, but this specific one, just, I don't know why, it just stays with me. The child had clear, I mean, it was very clear from when I spoke to the mother, but unfortunately I didn't meet her at the beginning. She went through visits to the GP, numerous visits to the GP and health visitor, and no one really was able to help her. And she went private and had a skin prick test done. And her child definitely, at that point, showed clear symptoms of an allergy to cow's milk. Reflux, vomiting, you name it, all of that. And the skin prick test at this place she had it done showed that the child was allergic to wheat, but not allergic to milk. I'm trying not to laugh because it's actually not funny. So she got so desperate, and she saw my posts on Instagram, which, thank goodness for Instagram, because, and this is why I'm so passionate about this, because I feel like it's something, you know, helping a child with non-IgE cowsmilkproteinallergy, it's actually can be fairly straightforward. Well, for me, it can be fairly straightforward. I've seen so many children, and it's all about eliminating the food and then take it from there. And we spoke and we eliminated because he was on formula, and she tried all the types of formulas you can think about, anti-reflux, comfort milk, all these formulas, nothing had helped. And we put her on a hydrolyzed formula, and within 3 days symptoms cleared, and she was just over the moon. And as most parents say to me, my child is a new child, and I can't believe this, and it's always great to hear. But you know, so here we are in a situation. It shows you clearly that a skin prick test is not a reliable tool. The child showed not positive for milk and showed positive for wheat. So here was a child that definitely had cowsmilkproteinallergy. So the way I did it, I diagnosed the child through my online consultations. I don't need to do a skin prick test. And I have a tool I follow, and it's very clear to me now. And then what we do safely, we reintroduce milk back into the diet, so normal cow's milk, after some weeks, and it's all different for every child. So sometimes it may be 2 weeks or 6 weeks or 7 weeks, I leave it, but I always go by clinical judgment. So we reintroduced it, and child reacted, so stop the milk. So we stopped the milk, it confirmed cowsmilkproteinallergy, and the wheat. So the mom was so worried about the wheat, and I said to her, do not look, we cannot trust the test, you already know that. So the test had caused fear in the mother, because obviously it showed negative for milk, though it was positive, and it showed positive for wheat, but she was scared. So do you see, these tests can also induce fear in us. And at 7 months, I said, listen, we need to go for it. I try and push my clients because I do not believe in eliminating a food group that's not really needed to be eliminated. So we reintroduced, we didn't reintroduce because the child was 7 months. So we introduced wheat and the child is fine. So trust your body. But you as a parent must trust your body first, because before you can trust the signals that your child is giving you. Does that make sense? So this is all about conscious parenting. So I'm a conscious parenting coach. So that is all about us trusting ourselves as adults, as parents, and looking at our children and really just, if they're showing symptoms, or if they're not showing symptoms, then you must trust that. And do not become obsessed with trying to label and having all these tools to help you further label something that you probably already know. So I hope that makes sense. I would love to hear from you. Leave some comments below, like or share this video, and also just to make sure that, at the end of the day, you probably have got nothing to lose if you do have a skin prick test, unless you've paid a lot of money for it. And if it had given you peace of mind, then, peace of mind is everything. So I'm not going to take that away from you. I'm just saying that sometimes we just have to think twice. And I have added some tools down beneath this video, because actually guidelines also clearly state that for non-IgE mediated allergy, we do not need to do a skin prick test. What we do is eliminate and reintroduce. So it's also according to guidelines. So that's it. It's Nishti here, specialist dietitian for children and parents, and I would love to hear from you.